the important thing to remember is that the risk of stroke in young women is very low. The birth control pill does double the risk, but doubling of a low risk is still a relatively low risk. And actually, we know it's about 1 in 20,000 people who are on the pill.
OK, let's underline that lots, because we don't want to put panic into folk, but even 1 in 20,000 is a worry. We talked about DVT within that film, and we talked a little bit yesterday, as you know, because you've been kind enough to watch the film. Do we know why? Do we understand what that connection is between the chemical formula that makes this contraceptive pill work and stroke? Yep,
so it's actually the estrogen that's in the pill. Yeah. So estrogen makes it more likely for your blood to clot, and it also raises your blood pressure, which is a risk factor for stroke. So that's the mechanism that's happening. We know that, for example, pills with lower estrogen carry a lower increased risk of stroke.
OK, fine. So, and that is at the heart of the chemistry of the pill. Without that, it simply wouldn't work. Kim Falkus got in touch with us as well, and this is an interesting one. Should women who use the contraceptive implant also be concerned?
So the evidence suggests that it's really the pill, the combined oral contraceptive pill and the patch that carry an increased risk of stroke. So the implant, we don't have evidence to suggest that those women should be concerned.
OK. And again, we mentioned there, and Alexa spoke to the Royal College of GPs yesterday about getting advice out there and what have you. In your view, from the Stroke Association point of view, what should people be most aware of, most women, if they're taking the contraceptive pill? What's the key thing?
The key thing, if you're on the pill, is to know what the other risk factors for stroke are. So if you have any more than 2 of the following risk factors, you need to be aware. So if you're a smoker or you stopped smoking less than a year ago, if you're over 35, if you have a family history of blood clots, if you have diabetes, and crucially, if you have migraines, that is a risk factor. If you have very severe or very frequent migraines, you need to talk to your GP about other options.